Hi, everyone. We're going to get started in just 1 minute. We're going to allow uh, time for people to come on in. We'll start right at 2 o'clock. All right, it's 2 o'clock. So, one of the things I'm known for is being very, very on time. So, we're just going to go ahead and get started. My name is Dr. Sonia McGowan. I am the owner of Covenant Chiropractic and Wellness in Jefferson City, Missouri. I am a MAPS trained physician. I am a pediatric chiropractor, and my specialty and my passion is working with complex kids and really digging deep into figuring out the why behind their behavior. So, hence the name of my sort of my second business, which is called The Why Matters. And so, through that channel, I provide webinars and soon to be a podcast and some physician training as well. So, I'm really glad you're here today. We're going to be talking about low cholesterol and its effect on complex kids. All right, so let's move ahead. So again, what I really concentrate on is not band-aiding a child's issues. We're really looking at the why that underlies their complexities, right? So there are no purposeless behaviors. There's always a reason for the things that kids do, and as complicated and as difficult as their issues can be sometimes, there's always a reason. And what I really am all about is figuring that out. And so just a little bit about me. Here you'll see myself with my husband, Shannon. He is a CPA, and we have two kiddos. We have Libby, who is 19 and now in college, living in Kansas City. And then we have also our son, Rowan. And that's him that you see kind of there in the middle as a little guy with hands over his ears trying to get his hair cut. And this below that is just him a few years ago. He's now 18, getting ready to leave for college. But when he was a tiny kid, he was also quite complex. And so we had lots of challenges with him. He was nonverbal until he was about 4, self-injury, lots of behavioral issues, lots of skin problems, diarrhea, sleep problems. And so although he never had a diagnosis of autism, I do consider him my first recovery story. And he is now, a completely neurotypical teenager. Like I said, getting ready to go to college to be a musical theater major. And still have this picture of our Lola. Lola was our English bulldog. We just lost her in December. And so we still kind of are waiting to hear her footsteps through the house. All right. So we're talking about cholesterol. And so most of the time in our society, we are encouraged to have low cholesterol. Like we want, your doctor will tell you, oh, your cholesterol's too high. We've got to give you a statin drug to lower that level. But when we talk about kids, and specifically complex kids with autism, kids with ADD, ADHD, PANS, PANDAS, etc., we need to pay attention to the cholesterol level, but to make sure that it is not too low. And I'll talk to you about that as we make it through this webinar. And so just a little bit of background about cholesterol, a very misunderstood molecule. So it's a waxy, fat-like substance that's made in the liver. You can also get cholesterol through your food as well. And so there are a couple of different types of cholesterol. So cholesterol travels through the blood on special proteins called lipoproteins. And if you've ever had a lipid panel, you've seen LDL, HDL, VLDL, etc., as subtypes of your lipid panel. And so on the LDLs, this stands for low density lipoproteins. Sometimes this is referred to as your bad cholesterol. And so in mainstream medicine, high levels of LDL is considered something that will promote cardiovascular events. So you don't want your LDL to be too high. And then we have high density lipoproteins, or HDL. Sometimes this is called the good cholesterol. And so high levels of this reduce your chances of cardiovascular issues. And then we have triglycerides. Sometimes you'll hear them called trigs. And so this is a type of fat that flows through the bloodstream and is used by the body for energy. So today what we're talking about is the total cholesterol, which would be including both HDL and LDL. I should mention too that if anyone has a question, just drop it in the chat box or the Q&A box, and I'll watch for those and try to answer them when I can. So what does cholesterol do for the body? So it maintains the integrity and the fluidity of our cell membranes, especially in the brain. So with your cell membrane, it has to be rigid enough to maintain the shape of the cell, but it has to be permeable enough to allow good things in and bad things out. So we want integrity and fluidity of that cell membrane, and cholesterol is a big player there. It's very important for the development and the function of our brain. So if this is a child, this is extraordinarily important, right? Because they're still developing. One of the things that cholesterol helps with is the development of myelin, which is that insulation around the nerve cell that allows those neurons to have those impulses move very quickly. Cholesterol is a building block for human tissue. It is a precursor for growth hormones and sex hormones as well. So things like any steroid hormone, so testosterone, estrogen, progesterone, etc. So if, let's say, you are a tween with complex needs and you're on the verge of puberty, if you have low cholesterol, puberty is going to be pretty hard on you, right? Because if cholesterol is the precursor of things like estrogen and testosterone, and you're having a greater need for those things as you enter puberty, then it's my personal supposition that that's why we see such increases in behavior and other difficulties as kids approach puberty. So cholesterol is also an important component of hormone receptors such as GABA and serotonin. It assists in bile production in the liver, and it helps make vitamin D. And so in terms of levels that are considered normal, generally mainstream America really wants your total cholesterol to be less than 200, your LDL to be less than 100, for your HDL to be more than 40, and for your triglycerides to be less than 150. And so if we look at it from the perspective of what's considered low, so a low normal would be 160 down to 130. My personal approach in my practice is if a kid is anywhere around that 160 or less, we definitely will supplement cholesterol. And I'll talk to you more about that as we move through this. Moderately low cholesterol is 130 to 100, and then anything less than 100 is considered very low cholesterol. And, in my clinical practice, over my years and years of really paying close attention to cholesterol in kids, I have seen many kids who are under 100, and they generally have some accompanying behaviors with that. So why would someone's cholesterol be very low? So sometimes it's because of malabsorption. So their digestive system just is not very robust. Their small intestines are not great at absorbing their nutrients. Often this is because of intestinal dysbiosis. So maybe they have an overgrowth of bacteria. Maybe they have an overgrowth of yeast that's promoting inflammation, promoting permeability, and decreasing their ability to absorb their nutrients. Sometimes it's because of deficiencies. So if you don't have all of the nutrients in adequate levels in your system, then you lack the cofactors that are required to help those cholesterol molecules be synthesized. Sometimes it's because of poor cholesterol transport. So kids with complex needs are just well known to have impaired pathways. So they don't have great transport pathways. They often don't have great detox pathways. And so this could definitely be an issue for a complex kid. Inflammation and high levels of stress will reduce your levels of cholesterol. And then there can be genetic causes as well. So for example, there is a syndrome called Smith-Lemli-Opitz syndrome, it's a genetic situation that causes mutations in cholesterol synthesis. And so particular to this syndrome, the lower the cholesterol, the more severe the symptoms. And so this was sort of the entree into scientists figuring out the connection between low cholesterol in kids with autism and accompanying behaviors. So let's talk about autism specifically. So a study by Harvard University found that people with autism are twice as likely to have abnormal lipid levels, low, and other studies suggest that they may be even 3 times more likely to have low cholesterol than neurotypical people. So, symptoms of low cholesterol. On my Facebook post the other day, as a reminder for this webinar, I wrote that cholesterol isn't very sexy, right? It doesn't really sound that interesting, but I can tell you, if it's too low, it will cause some pretty significant issues in kids. So some of the symptoms that I have seen in my practice are sensory issues, very little ones who have what is considered failure to thrive. Very often it is low cholesterol. We see things like irritability and poor sleep. We see language delays, that's very common, as well as poor sleep. Lots of kids, when moms and dads, report that they are having trouble going to sleep, staying asleep, or they're waking up too early in the morning, I immediately think, do they have low cholesterol? Self-injury and aggression is common in kids with low cholesterol. Social skills challenges, low muscle tone, mood challenges, so things like depression. We've seen things like suicidal ideation. We've seen behaviors that look like bipolar disorder, all related to low cholesterol. We will also see a late onset of puberty, and that should make sense to you now, right? Because my comments before about puberty and how how cholesterol is required to make steroid hormones. And so if you're not able to make enough hormones because you don't have enough cholesterol, then that can cause a late onset of puberty, as well as severe menstrual syndrome. Severe menstrual symptoms in females. And again, that should make sense, right? Because you have to have cholesterol to make estrogen, testosterone, etc. It's very common to see a lot of fat in the stool. Sometimes even we, in older people, have seen cancer and drug addictions as a result of having cholesterol that is too low. So how do we increase these levels? So diet is one way to do that. So we can encourage diets that are higher in cholesterol. So encouraging foods like eggs and full fat dairy, red meat, shellfish, specific oils, organ meats, not for me. Some people like it. But part of the challenge here is that most of the time, kids with autism and other complex needs tend to be very selective eaters. So it's not like we can just say, hey, eat a couple more eggs today, right? And for many, many kids, they also have some food allergies or food sensitivities that may prevent them from getting all the cholesterol they need via food. And so a really nice option is something called Sonic Cholesterol. So it was created as an option to safely raise cholesterol levels, and it's made from purified sheep's wool. So it's really the only option that we have in terms of a supplement for cholesterol. And it's really great for those kids or adults who can't tolerate eating high cholesterol foods in their diet. Now, the thing about Sonic Cholesterol is that, first of all, we base the dose of Sonic Cholesterol on the actual lab value of the total cholesterol. And so because it's dosed based on the level of cholesterol in the system, this product needs a physician authorization. So you have to work with a doctor who knows about complex kids and who understands the role that cholesterol can play in behavior and development, and who can order the labs just basically a total cholesterol blood draw. And so because sonic cholesterol is designed to support optimal levels, you have to work with a doctor who can monitor those numbers, repeat those labs to make sure that the child is on the appropriate dose for them. So in terms of outcomes, what have I seen in my patients when I find low cholesterol and we intervene using sonic cholesterol? So, I mean, I've got hundreds of stories about this from, kids who are aggressive, who are self-injurious, who are pre-verbal, who all improve using sonic cholesterol. So I've seen changes in language. I've seen changes in cognition. We see aggression that goes away. We see depression and other mood issues improve with the use of sonic cholesterol. So it is a really, really important thing for you to know if you have a kid with any of the symptoms that I mentioned a couple of slides back. So if you are concerned about your child having low cholesterol, it can be a challenge because there are very few doctors who understand the role of cholesterol and its relationship to autism, puberty, mental health, and other challenges. So I've worked with kids with autism literally my whole adult life through college. Then I worked for the Judavine Center for Autism in Missouri, met thousands of families in that way, and then became a physician. And that has been really the focus of my practice for the last, 13 or so years. And so I have many years of experience using sonic cholesterol with kids and adults as well. And so for families who tuned in today and would like to establish with me, or for established patients who need to schedule an update appointment, as you know, I do offer telehealth, and we're offering a special discount. So you may have $50 off of a new patient appointment, or $50 off an established patient appointment as well. Now, keep in mind, that's the visit with me to take a history, do an exam, figure out if this is an appropriate approach or something we need to rule out. The cost of labs would be additional. So the blood work required to look into this issue for your child would be extra. And so if you want more information, if you want to contact my practice, again, I'm in Jefferson City, Missouri, which is the middle of the middle, so right in between St. Louis and Kansas City. If you're not local or in a driving distance, I do offer telehealth visits as well. And so you can always email me, as you see there, Dr. Sonia at covenantwellness.net. You see the phone number there as well. And then you can also have a look at us on social. So we're on Facebook and Instagram. So I hope you found this valuable. Just a little quick overview of low cholesterol and how it might be affecting kids with autism or other complex needs. And I hope that you see the value in really making sure that this is not something that could potentially be contributing to your child's challenges. So again, if you have any questions, feel free to email me. If you'd like to make an appointment, you can do that by calling our office. This is Friday the 7th at about 2:20 p.m. Our office is actually closed, but we'll open again on Monday, and we would be happy to get you scheduled for that. So we have a couple of questions in the chat. Sherry, hi. She says, Dr. Sonia, you have such an amazing heart for our kids. Well, I do, and having experience as a mom of a complex kid, as a toddler, I remember what it feels like and how challenging it can be, and just really wanting to find every answer. And so, yeah, so I'm really happy you're here. It's good to see you, Sherry. And Kate, nice. I'm so glad you're here too. You were on my last one as well. So absolutely, I'm really happy that you're here. If anyone has any other questions, we can definitely hang out for a couple of minutes and give you time to drop those questions in the chat box or the Q&A box and I'm happy to answer that. I should probably mention, while we're waiting for people to leave some questions, this is one of the main things I look at in kids on the spectrum and kids with complex needs. But another really common thing that I try to make sure I'm looking at on labs for kids is mitochondrial function. And it's exceedingly common for our kids to have low cholesterol, to also have impaired mitochondrial function, to also have fat maldigestion and low vitamin D levels. And it all seems to be related. So these are things that I look for in almost every kid who passes through my doors. Kate asks, can supplementing vitamin D high doses be an issue with low cholesterol? I'm wondering if you're asking if vitamin D can drive cholesterol levels lower. If that's what you're asking, I have not seen that in clinical practice. And if I didn't answer your question completely, feel free to clarify in the chat box. Any other questions that I can answer for you before I let you go on with your Good Friday? I will let you know that in 4 weeks on May 5th, so the first Friday of May, my next webinar will be my top 5 recommended supplements for complex kids and adults. So I'll be talking about the biomedical features that I see in kids. So what do I see in terms of symptoms and physical features that lead me down the path of knowing what to recommend for someone? And then talking through each supplement that I tend to go for first and the reasons behind that. So that will be Friday, May 5th at 2 p.m. And you'll be seeing all of the promotion going out for that very soon. And so Janice, hi Janice from Pennsylvania. Ryan is about to have lab work based on our last appointment. My question is, how long should I stop his fish oil supplements that we give him before the blood work to get an accurate reading of his cholesterol? You know what, I'd probably say a week or so would be appropriate for that. That would be a good, safe thing, unless you feel like stopping the fish oil will cause him to regress in any way. And if you feel it will cause him to regress, then I'll just analyze that lab through the perspective knowing that he was on some supplements. Laura says, thank you for explaining the mechanisms. Can we look for the low cholesterol to resolve with age? You know, that is a great question. And knowing Lauren, like I do, I don't really foresee it improving with age. And, you know, an interesting thing, this is an aside, cholesterol should increase as we age. So for Lauren, I think it may increase some, but I don't know that it will ever get her to the point that she needs to be without supplementation. So cholesterol should increase as we age because it's protective against cancer. So while I would not want your cholesterol to rage out of control as you age, I definitely would want to help patients understand that there are ways to keep a good, optimal, healthy level of cholesterol naturally without using a statin drug to lower your levels. Because you think about, if it's protective against cancer, you know, what's happening with cancer rates in the United States. Draw your own conclusions. Sherry, hi. All right, so what's your favorite seasonal allergy remedy? That is a great question, because allergies, I know kids are really struggling starting right about now. So I'm going to have to let my Rolodex run for a second. There is a line of homeopathics called Pekana Remedies, Pekana. And they have a couple of beautiful seasonal allergy remedies that are liquid, easy to take. They don't taste too bad. They work really, really well. I'm actually having a little bit of a blonde moment trying to remember the names, but if you want me to, when it comes back to me, I can email you those if you would like. But Pecana is a beautiful line. They have lots of really excellent remedies. And I have people who tell me that the allergy remedy from Pecana is amazing. I also like Dehist from Orthomolecular Products. So Dehist or Dehist Junior, just depending on the age of the child or adult. So those are kind of my two favorites. All right, other questions? You guys have great questions. I'm so glad you're here. This was fun. Sherry says that would be perfect. Thank you for these awesome webinars. Great. So I'll try to remember to email you. And if I don't get back to you by like Monday or Tuesday, just shoot me an email to remind me. Okay, and Laura would like that information to us too. Great. In fact, I'll try to, maybe I'll just send that out to everyone who registered, and then I won't have to remember. Gabriella, hi. What are your ideal adult female total cholesterol ranges? Dr. Shaw believed 220 to be protective for men, but haven't seen this range for women. So yeah, I agree with him. So I like, anywhere from about 200 to 225. That seems to be optimal for both men and women. And so that's generally what I recommend. Other questions? I hope everybody has a really good Easter. I can't believe it's here already. My daughter's coming home from college, so I'm looking forward to the weekend, being able to see her. All right, last chance for questions before I let you go. All right, very good. So remember that because you registered, you will get a link. Laura says Happy Easter. You will get a link to the replay that you can watch as many times as you want to. I have also uploaded the slides as well, the notes pages. So, but if you need anything at all, just email me, Dr. Sonia at covenantwellness.net, and we'll get you fixed up. So again, thanks so much for being with me. Watch for the promotion for the May webinar, and also kind of be watching. We should be releasing our new podcast hopefully in the next week or two. So it's called The Why Matters, and we're talking to parents and professionals about, sort of the why behind our complex kids and their behavior. So I loved spending some time with you. Oh, hello, Gina. It's good to see you too. Much love all the way to Texas from Missouri. So, so many of my favorite people on the webinar today. It just makes me happy. So everyone have a fantastic weekend, and we'll see you on the webinar in May.